I'm Dr. Maharsh Patel, one of the hand and upper extremity specialists here at Ortho, Georgia, and today I'll be talking to you about hand fractures. So a lot of people injure their hands, whether it's at work or around the home or from sporting activities. And even though hand fractures may involve small bones, they can oftentimes lead to bigger issues from a functional standpoint, since we have to use our hands, throughout our lives to continue and do what we want to do. So there are multiple bones in the hand. Specifically, there are the metacarpals, which make up the bone and the portion of the hand from the wrist to the knuckle. And then there are the phalanges, of which there are 3 in the majority of the fingers. One called the proximal phalanx, the middle phalanx, and then the very tip is called the distal phalanx. And any of those could be fractured after a traumatic injury. Most of the time, if the fractures are non-displaced, which means they have not necessarily shifted, then we're able to treat those conservatively without surgery. Sometimes, depending on the patient's activity level and what they do from a physical standpoint, surgery is recommended. And the main reason for that is to allow for them to regain their motion and function a lot quicker. For example, if you have a broken finger or a broken hand, oftentimes we fix it with wires or plates and screws so that you can start moving it a lot quicker with therapy. And that way the fingers don't get stiff, since they are very prone to do that after any type of injury. Non-operative management of fractures, including casting or splinting, is an option. The biggest drawback to that, depending on the fracture, oftentimes can be stiffness. But with our certified hand therapists here at Ortho, Georgia, whether you have surgery or not, they will make sure that they do everything they can to get you back to function and using your hand as best possible. One of the things that we always tell patients is that ultimately, from a fracture standpoint, we want what's in their best interest, and so it is a joint decision between myself as the physician and the patients in terms of what they would like to proceed with. And a lot of times, if they would like to try the non-operative treatment, I think that's reasonable, but there are definitely some incidents and injuries that we would recommend surgery right away, especially if the fracture is displaced or shifted. And for those, we have an outpatient surgery center here at Ortho, Georgia in Building A, and the surgery is typically same day. And our staff over there is wonderful, and they will make sure that you get in and out as quickly and efficiently as possible and on your way to a speedy recovery. So please, if you have any issues with your hands, including fractures, come see us at Ortho, Georgia. We would love to take care of you.